Now to the latest on the flu in Virginia after health officials reported a second pediatric death related to influenza last week. Marta Berglund has more details.
Both child flu deaths this season in Virginia happened in the eastern region. The first, a preschool-age child, and the latest, a teenager whose passing was reported last week. But the latest flu numbers, which were published Tuesday, show overall disease levels are still low and are dropping again. Influenza or flu diagnoses accounted for less than 2% of emergency room visits last week, or roughly 1,200 cases. This is the first time that number has been below the 2% threshold since early December. As for the number of deaths reported in relation to the illness, VDH says it hasn't gotten word of any for the past 3 weeks, but those numbers can change if the agency gets delayed information. Since late January, vaccination rates have gone up by less than a percentage point. 31.9% of Virginians have gotten the flu shot in comparison to last week's 31.8%. COVID-19 vaccine rates are also mostly unchanged. Roughly 11% of residents are vaccinated. Here in Hampton Roads, flu levels are at a low level across the entire eastern region over the last week. 12% of emergency room visits were either related to influenza, COVID-19, or RSV. Health experts say the majority of patients visiting the hospital because of respiratory illnesses are children, including infants, toddlers, preteens, and teens. 413 News Now, I'm Marta Berglund.
Experts with the Centers for Disease Control do not advise going to the ER if you're having mild flu symptoms. They say in children, blue lips and face, muscle pain, and a variety of other indicators can help tell adults when a hospital visit is necessary.